I'm in front of Sunnybrook Hospital, where Canada's first presumptive coronavirus patient remains in isolation.
The patient was detected and immediately put in isolation.
Confusion, fear, and uncertainty.
Overwhelmed, stressed, and emotionally draining.
Frightening, uncertain, and curious.
Oh my God, I did not see that coming.
Chaotic, unpredictable, and worrisome.
Scramble, uncertainty, and to some degree panic.
People were calling like they never called before. People were coming in because they were not able to reach out to the doctors.
Every staff member was coming in early, working through their breaks, staying late to make sure that everything that we could do was done.
We were basically at the mercy of the information that we were being handed down by the experts, and that was what we had to go with and, provide to our patients as well who came in to ask.
Patients had nowhere to go to, but pharmacies didn't close their doors. They opened them bigger.
In the pandemic, that accessibility was a lifesaver, a literal lifesaver.
That was important for me to actually go help people when they needed pharmacy the most.
Every patient under the sun came into our pharmacy trying to stock up on medications, asking lots of questions.
For well over a decade, certain medications have been in short supply. Now COVID-19 has made the problem worse.
I was having nightmares about running out of medications and having patients die on my watch.
While BC hasn't ordered it, it strongly encourages pharmacies to limit supplies for now.
Pharmacists were already doing it. They were facing a lot of harassment for that decision.
There were new rules. There was new data. There were new studies. Every single day was completely unpredictable.
The resources of government, science, and logistics being brought to modern-day disaster relief. The first needles prepared at Toronto's University Health Network, specific location withheld for security reasons.
We were getting more information about, the vaccines are going to start, who can we have on board to be able to participate in these clinics that we're going to have to roll out.
We would work in the dispensary all day long, and then we would run vaccination clinics in our staff room in the evening times.
I think the vaccination campaign introduced the pharmacist as a public health person in the community.
I was able to clarify and dispel a lot of the myth that is floating around.
When vaccine hesitancy was further highlighted by the pandemic, it pushed me to develop a YouTube series to help educate people about getting vaccinated against COVID-19.
If we really want to win the public discourse, there just has to be a louder voice speaking the truth.
Down the hill from the Montreal General Hospital is a small family pharmacy. Inside, Darren Basmagian is on a personal mission to give boosters to those with compromised immune systems.
It was indeed an honor and a proud moment to give the Prime Minister his vaccination.
It was such a huge relief too to be connected in to get our vaccinations against COVID-19, and just to be able to do that right at the pharmacy, and rather than having to figure out where else to go, it was right there and we could just get it done. And I remember my dad and I were both so relieved when we got that vaccine. We had never anticipated a vaccine that much before in our lives.
Pharmacists are now the #1 provider of COVID-19 vaccines in Alberta, more than any other healthcare professional.
The pandemic has completely transformed pharmacy practice for myself and my colleagues.
I've been here all morning, and around 7:30 people started lining up because this is one of about 1,900 pharmacies in Quebec that's handing out rapid tests.
Isolation shelters for vulnerable individuals were filled with people from across different cities and even provincial lines. I saw clients who are coming in who needed their opioid replacement therapy, and they are out of the province and they're not able to see any prescriber. However, things like the CDSA exemption allowed us to quickly connect with their previous pharmacy outside the province, transfer in their Suboxone, and dose them immediately on the spot.
We've noticed that you can do a lot of stuff when you're not physically at the site. So all of a sudden we can maybe start offering more rural areas the same kind of service that you would expect in a more urban area.
This gave me the opportunity to work with some of my Indigenous individuals in the Northern Reserves that are two-spirited in terms of addressing their healthcare needs.
The biggest thing that we hear from pharmacists now is it's just too much. You know, the staffing models, the working models, the hours of operation, all the regular responsibilities, they didn't go away. Pharmacists are now juggling too much, and we have to play this catch-up.
As this went from that short term, 2 weeks and it'll be okay, to a couple more weeks, to a couple of months, to a couple of years, you start to kind of discover what's important in life. You start to discover that it's okay if you're not okay.
I had been running it like a full sprint. I don't know if you want to call it a breakdown. I don't know if you want to call it burnout. It was just a crash and burn.
Not seeing my family at all during that period was really devastating.
I definitely experienced personal mental health challenges during these 2.5 years, but luckily having a good team with me has helped a lot in regards to overcoming this issue.
In the darkness, there was that really, really bright ray of hope in just how well a lot of our team was able to work together.
You went through something crazy, something wild together. Those friendships that formed and continue to support us as this drags on, I think we're pretty important. That's a lot of what got us through the pandemic, I think.
People understand the value of pharmacists, but not only that, pharmacists now understand the value of pharmacists.
It actually pushed me to actually be more into the profession by seeing how helpful we could be for our community.
So I'm really excited for what the future has to show, because when we had opportunities, we grabbed them and we took them and we ran with them.
At the end of the day, patients would be the ones that have the most to gain from us really finding our stride and finding our place.
As pharmacists, we're ever more evolving and we're ever more changing in terms of our profession and what we can do under our scope. And so I'm looking forward to seeing that the future is almost here and actually what it means for us going forward.
Pharmacists and pharmacy profession has risen up to the challenge and has risen up to overcome the challenges over the past 1.5 years and fulfilled the needs of the healthcare system and the public.
I see a future where pharmacy can use technology to make a maximum impact in the lives of Canadians as a whole.
If anything, the pandemic has shown us what we are capable of rising up to. Even if you don't feel like it, even if you're nervous, you have just shown yourself that you can do hard things. And the future is so bright for pharmacy.